Welcome to this demo on immunization. This demo will illustrate the functionality of a Health Information Exchange reference implementation, which was the output of a fast health interoperability resource training to support the Kenya patient summary. In this demo, we are going to see a fictitious patient, yet clinically relevant scenario, who initially lived in Nairobi and was treated at the Nairobi District Hospital between the years 2004 and 2023. And he then moved in 2024 to Kisumu, where he is working as a carpenter. While working there, he lacerates his right index finger and visits the health post. While at the health post, the community health promoter logs onto the ECHIS and assesses the patient. The community health promoter creates a household for the patient, enters their details, including their gender and demographic details. After creating the household, the community health promoter creates a member of that household and equally enters the details. And in this case, our patient is Mr. Joshua Test. The details include the patient's national ID, including their address, as well as their next of kin, the community health promoter obtains details about the patient's place of birth, as well as their village and their next of kin. As the assessment proceeds, the community health promoter also obtains from the patient relevant medical conditions. In this case, the patient is hypertensive and the patient also has HIV/AIDS, but does not have insurance. Once the community health promoters obtained all the information, they submit and begin the assessment. In this case, within their scope, they start a first aid assessment. The patient has got a cut. They have a wound. They receive prompts on how to manage the case, and they provide basic wound care, including analgesia. Once they complete, they are prompted by the system to refer this patient because the patient will need a tetanus immunization. The conversation between the patient and the promoter leads to the patient offering to share their health record because they cannot remember whether they've had a tetanus immunization in the past 10 years. So the patient logs onto the Smart Health Links portal, puts their details, and when they access the portal, they navigate to the summary view to check their medical record up to date. And they can see their allergies, medications, problem lists, and under the history of immunizations, they've received immunizations close to over 10 years, but in this case, it was a hepatitis vaccine and a Haemophilus influenza B vaccine. Then the patient desires now to share this information with the community health promoter. And so on their portal, they generate a Smart Health link. They name the link Community Health Promoter, and they go on to password protect it. Furthermore, the patient can also put an expiry date to the link. Once this process is created, the patient then can share this link with the community health promoter. Two ways the patient can use. The patient can either use a link or a QR code. Once the community health promoter receives the link, they paste it into their browser, and it then requires the access details which the patient has shared with the community health promoter. In this case, the name, community health promoter, and the password 000. Once they submit, they've got access to a view of the patient's details, and they can confirm the history of immunizations, as well as obtain any other valid information that the patient has shared with them for the treatment of this patient. At this point, the patient is now referred to Kisumu District Hospital for a tetanus vaccine. While there, the healthcare worker who receives the patient accesses the system, proceeds to go to referrals, and queries the SHR to get a referral of this patient. Once that is obtained, they can then register the patient, because this patient is known and was seen at another facility, that's the Kenya EMR. The health worker is able to access a summary of the patient and can see that the patient has not received any tetanus vaccine in the last 10 years. And so they go forward to administer the vaccine and to update the electronic medical record. And they navigate through the vaccines, and they put in the right vaccine and the right details, and they save that. And the Kenya EMR is updated, as well as the shared health record. Once this information has accessed the shared health record, the patient is referred back to the health post for further wound care. While there, the patient chooses to access their Smart Health Links portal to ensure, at least to share correctly, what was done for them with the community health promoter. And so they access the summary of the treatment, and they can observe that under the history of immunizations, there is an additional vaccination named tetanus toxoid. And so Mr. Joshua informed the community health promoter that they could use the link as it's still valid for a month, the same link that they had received previously. So community health promoter, to be sure, accesses the link, which it still has the same name and password. In this case, 000. And once they access, they will navigate to the summary view of the patient and check that the patient's immunization has been updated on the SHR and is reflecting in the Smart Health Links portal. And at this point, the community health promoter is satisfied with the care. He then schedules the patient for a further visit. Thank you.